Oh, we're back. You know, Madison Healthcare has a top-tier reputation, but behind the rankings and the awards, there are patient stories that paint a much different picture. It's the focus of a riveting expose by Madison Magazine this month. And digital editor Anna Katakis is here this morning to talk all about it. So, Anna, you met with a lot of different patients for this story in your reporting. How would you sum up their experiences?
Yeah, and I think it's something that resonates with even patients I didn't speak with, right? But there's a lot of frustrations and a lot of disappointment that come with being a patient and interacting with healthcare. Even somewhere like Madison, where we have these great hospitals, we have these great doctors, we have all these really innovative biotech and life science companies. So I was finding that a lot of patients are experiencing really long wait times just to get an appointment, just to see a physician. And then when it comes to primary care, they were having really short visits where they weren't really getting their needs and their concerns met. And on top of that, they're paying a premium for that experience and still not feeling satisfied.
Boy. So, I mean, what's the solution here? I mean, what can we do about it? What are these patients doing? What can folks at home do if they're experiencing the same thing?
Yeah, so for a lot of the article, I do focus on primary care. There is something called direct primary care that's really growing in Madison, really taking off here. The way that works is people pay a membership instead of a fee-for-service model. They can see a primary care doctor for an hour per appointment for as many appointments as they want once they're a member. It's outside of the traditional insurance-based model. So a lot of people are turning to those alternatives to kind of solve that problem.
I mean, do you see this as something that's going to transform the healthcare industry, or is this just, you know, one of those options in the healthcare industry is just too big, you know, to be, you know, radicalized or changed, or any, overwhelming, shift in how people receive healthcare?
Yeah.
So is this just kind of like, it's an option?
For sure. I mean, direct primary care is a supplement to other kinds of healthcare. It's just for primary care, so it can't be your one-stop shop for everything. But I think it's really encouraging that in Madison there are physicians and practice owners and patients who are willing to look for those other options and create them if they don't exist, to find those solutions.
So Anna, where can our viewers find the article?
Yeah, you can find it online on Madison Magazine, or you can also buy our print issue and find it there.
All right. Thanks for your reporting and sharing your story with us this morning.
Yeah, thank you.
Appreciate it.